terms favorable to Pakistan, as has been in the case in the past. If Pakistan starts acquiring low platforms which are low observable, in other words, stealth platforms.
Hello, Moto.
Motorola, India's leading AI smartphone brand.
Innovation, access and partnerships. As India aspires to build a truly inclusive healthcare system, the future of health equity lies at the intersection of innovation, accessibility and strong partnerships. India must reimagine healthcare delivery models that are not only cost-effective, but also equitable, ensuring that no one is left behind on the path to a healthier nation. On my panel today to talk about this very, very important issue, especially if we talk about Viksit Bharat 2047, we have Dr. N.K. Arora, Executive Director, the Inclin Trust International, Dr. Shekhar C. Mande, former DG, Council of Scientific and Industrial Research, Dr. Samir Gupta, Senior Cardiologist and Director, Metro Group of Hospitals, and Annapurna Das, General Manager, Takeda Biopharmaceuticals India Private Limited. Thank you so much all for joining us on this very important issue. And Dr. Arora, I'd like to start with you first. If you could explain to us, when we talk about equitable health, what does this mean in the Indian context, and what kind of a role can technology play in this?
So, thank you very much for inviting. Equity, the true meaning of equity actually is reflected in healthcare and how, and I must also say that India's immunization program also is an example how equity can be achieved, and equity can be achieved very well. I mean, just to give an example, that today 93% of our children are fully immunized, and about 6% children who are left, particularly only 3%. Now, that is an example that every child has to be reached for immunization. And you ask, so that's how I define that anybody who requires health care has access and able to not only access, but able to utilize the services. As far as technology is concerned, I think technology is most efficient way of achieving equity in our kind of setups, which has got a very heterogeneous population groups, very diverse geographical aspects and distances. So technology will not only help us achieve equity, but two other things also come with that. Technology helps us to achieve accountability also. And the third dimension is, which was just mentioned, that technology also allows the access to those aspects of healthcare which are normally even not dreamt of. So if I want a super specialist, how do I reach somebody who is in the remote Arunachal village? So technology is the answer and is the cheapest way of quickly achieving or scaling up our equity efforts.
All right, and you know, India should be able to use technology better and better. Earlier we heard the minister also talking about, you know, AI centers that have been set up in the previous panel as well. They spoke about how AI is being used, you know, for to health even at the rural level. Annapurna Das, next question to you. And you know, we've been talking a lot about partnerships and how they can help in this journey of better health for our public. So if you could tell us more about, you know, how you know, partnerships can increase access to healthcare in India.
I think talking about equitable access, I think what's important to realize that achieving health equity is a collective responsibility. I think what it makes that as Takeda, we are forging strategic partnerships which are primarily aligned to the national priorities, with the healthcare ecosystem priorities. Access to medicine, if is as a global pharmaceutical player, is core to our core business strategy. And we primarily work that all our medicines, vaccines are made accessible. We can broaden access to the most people who needs them the most. What Dr. Arora was talking about, that people who need it the most. Fundamentally, I think we work with 3 pillars. Number 1, innovate to impact. Number 2, which is sustainable access, and number 3, which is health system strengthening. Now, if you look at all of these, you can blend different models of partnerships, which can be cost-based partnerships, joint funding in innovation, it can be manufacturing partnerships. So there are different models of partnership. One of the things that we believe is, I believe that would be very helpful is working with state governments, state health departments to increase the capacity for clinicians to diagnose, but as well as treat, non-communicable diseases and vector-borne disease. I think that's fundamental, that how you can drive the kind of community. The other piece, the last piece here, is the community-centric approaches. Fundamentally, when access programs are designed with inputs from community, they are far more inclusive, they lead to better outcomes. And that's what our learning. So I'll sum up by saying that partnerships are not enablers. They are just so fundamental to drive the equitable access in a country like ours.
Well, thank you so much. You recounted about so many examples that have worked, and that's what really we need right now to show, that how things are working on the ground. And that brings us to policy. And Dr. Mande, if you could talk a bit about, how we can ensure that we have the correct policies, because what we need is more innovation, and we need innovation that will help, rural parts of the country, underserved parts of the country as well. So how can, be it state governments, be at the central level, how can we help, push for those policies that will create this innovation and technology that can give more equitable health?
Yeah, first of all, thank you for having me here. That's a very important question. If we talk of innovation, we see innovation at all levels across the country, in rural areas, in remote areas, in urban areas, in our households. Everywhere there are signs of innovation that are all the time. What our mothers do essentially all day are trying to innovate on their own to make the household very livable and very pleasant. The tech-led innovation is essentially using the technologies, and a larger section of society can benefit by those. By that kind of innovation actually is what we believe would eventually drive the society forward. Now, the first sign of this we actually started seeing some years ago, when institutions such as different IITs and all took the lead and gave some space to the youngsters. For example, IIT Madras, IIT Bombay and all, they set up these technology parks and gave space to youngsters to try out their ideas in scaling up their innovations. Right? That's the key issue. The policy framework for that at that particular point of time did not exist, but soon what was followed was something like Startup India policy and things like that. They came in the last few years. Now the government's role in this is multifold in promoting innovation. Number one, government creates appropriate infrastructure for anyone to come and use. For example, government, in the very larger sense, for example, government lays down power lines, government makes roads, and things like that. But the second thing, when people want to test out their ideas for scaling up and going to an industrial scale, government actually should stay out of it. Now, one of the major policies of government to actually stay out of that, so when kids are coming out of our academic institutes, say IITs, NITs, universities, colleges, these kids are bubbling with ideas. And they actually want to try out their ideas and try to see whether these ideas can be scaled up and a larger society can benefit. And that's exactly where the government actually should step back. It should promote the early ideas by providing certain kind of funds and all, but not regulate those ideas. And so if our policymakers
give them a push, but not go,
that's right. Not have any extensive regulations in governing those ideas and innovations. So that would be actually a major role for the government to play.
All right, so that's a very interesting point that you made there. Dr. Gupta, coming to you, you're a doctor, you run a hospital as well. So if you could, we're talking about, public-private partnerships, if you could talk about examples that you've seen or where you feel, this could help in terms of, diagnostics and other hospitals as well.
Absolutely. So let me first begin by saying that, for our, the dream of our country is Viksit Bharat, right? 2047, we have to be a developed nation. And I just want to put it out there, we cannot be a wealthy nation if you're not a healthy nation. So health is of paramount importance, and I want to congratulate everyone for bringing up this panel and talking about health, which is a very neglected subject in general. Talking about public-private partnerships, it is, it's kind of an innovation in the healthcare delivery model, right? Traditionally, if you have to build up a hospital, if you want to deliver healthcare, you buy a piece of land, then you construct a hospital on top of that, and then you deliver, you put in manpower, and the patients come, and that's how traditionally things work. Public-private partnerships come in different flavors, right? Either the government gives you subsidized land, or they give you a pre-established hospital, which is existing, or for that matter, a diagnostic center or whatever. They give you, either they give you a land on which, at a discounted rate or a free rate, whatever, and you construct a hospital on top of that and then deliver healthcare. Or they give you a half-made hospital or a hospital which is not optimally functioning, and then you come in as a private partner and deliver healthcare over there, and then in lieu of this services that you've been given, the land or the building that you've been given, you give a discounted or free healthcare to a certain percentage of the patients who come to the hospital. So that's usually how private partnerships work.
Yes, that's how it works.
Now, public-private partnerships also play a very important role in healthcare education, right? One of the biggest challenges we face in healthcare in India is manpower. We don't either have good manpower or we don't have enough number of manpower. And, the government is now coming up with different schemes. I saw some policy work coming out of Uttar Pradesh, where the government is saying that all the district hospitals, we will convert them into medical colleges. And subsequently, we will have so many more medical colleges. The number of the patient-doctor ratio in India, which is has scope for improvement, that can be increased. And the quality of that district hospital will in turn also improve, because now there's a medical college over there, there will be better doctors, there will be better staff over there, etc. So I think public-private partnership is a very important and a very key role if we have to get healthcare delivery and equity for all, as was discussed.
Is your business future ready? Join the 13-week strategic ESG certification program for business sustainability and growth for CXO and business leaders by NDTV, Terry and Zenora. Master global ESG frameworks, gain real-world tools, and lead with impact. Starts July 13th. Enroll now and power your business with sustainability.
I've been reporting on all issues big and small from Andhra Pradesh, Telangana, rest of South India, bringing you all the action, all that you need to know, all that you want to know.
The energy of maximum city is infectious. I'm bringing that energy in our news coverage from financial capital Mumbai.
Covering from the southernmost part of India over the last 23 years, I bring in-depth and 360-degree coverage from the Dravidian heartland.
The land of Mishti, also known for its bitter politics. I have seen much water flow under the Howrah Bridge, covering Bengal in all its vivid colors.
India's IT capital is always bustling, a city full of startups, stories and surprises. And I keep you ahead on all the Bengaluru buzz. Some say sport is a matter of life and death. The truth is, it is far more serious than that. Sport is about ecstasy and agony, about pain and suffering, about joy and much more. Some say there's no one better to tell these stories. So here I am. Join me, Boria Majumdar, on India's #1 news network.
I'd like to come back to you, Dr. Arora. We're talking about, how we can have healthcare for all, how we can, use public-private partnerships. What are the obstacles that you see? And earlier during the sessions, we spoke about how certain doctors have, gone and worked with tribals, gone and worked in rural parts, but that is their own personal mission. How can we have more of that? What are the obstacles in, ensuring health for rural India, for tribal India?
One of the major at the moment roadblock is the shortage of manpower. And if I give you the figures, it's mind-boggling. In next 20 years or so, we are talking about 2047, we require 30 lakh more doctors. The second is nurses. About 80 lakh nurses, 50 to 80 lakh nurses and other paramedical. Therefore, the shortage is huge. Today, if I look around the whole country, every state health department has 40 to 50% deficiencies. Even medical colleges getting teachers.
As large as that?
As large as that.
Wow.
So that is something, therefore, we have to bring in innovation in terms of skilling our manpower and get them. So this is a huge area where opportunities exist. The whole concept of digital health has come in, that we are talking about Aadhaar ID. That means we have electronic health records of every individual, issues of confidentiality, issues of maintaining the data is properly used. But the most important is once Aadhaar ID and its usage is there, it should be available right up to the level of health and wellness centers, which we call Ayushman Arogya Mandis these days. So technology here is again important, that we need to have the improvement in the quality of data so that we can use.
That's a very interesting example you gave, and where there's some lacuna and maybe there's there has to be a push for improvement there. But taking from what you spoke about AI, Ms. Das, if you could tell us how Takeda uses AI and what is the long-term plan?
Yeah, so probably I think from the digital technologies or AI is transforming, particularly from making it very personalized, patient-centric, and accessible. For a global biopharma like Takeda, I think what we focus on integrating it across channels, okay, so that we can, whether it's for its internal and external stakeholders as well as for HCPs and patients. I think one of the things, maybe I'll quickly give you two examples. I think the focus is for HCP engagement and education. If you see that, I think what happens, like if AI is able to really give personalized HCP specialty and profile-based evidence to the physicians. It is also, I think, the predictive analytics that you do is able to give the progress of the disease. And as a result, the clinical decisions can be made with that help. This is one big area where we work, and we have tied up with Salesforce, I think, to bring a life science cloud-based model, which gives the AI agents and AI analytics so that the physician, there is a real-time streamlined interactions between physicians with commercial teams, with patient support teams. I think this is a major shift in how AI being used.
Right.
The other big area is, of course, patient education and patient support. I think this is what the technology plays a role. So I'll give you just one example here. It can be for faster diagnosis. It is for giving better treatment outcomes. So we are working on something, an AI-enabled app for IBD. Okay, so if you know that, which is kind of heavy, this is a disease, and this would help patients to really track their symptoms, okay? Kind of also track their relapse, help them get counseling, get them support. I think as a result of AI and technology, I think it kind of brings the provider and the patients together for that support. I think that there are multiple examples. At the end of the day, the objective is to create that faster, accessible of these treatments to the patients to improve their quality of life. That's most important.
All right, and earlier on, Dr. Mande, I want to come to you. We were speaking about how the burden of disease is shifting from infectious to lifestyle disease as well. So how does this affect our, if we're talking about health equity agenda, how does this change, impact that?
Yeah, indeed, the burden of disease is dramatically changing in the last 20 years from communicable to non-communicable or lifestyle kind of diseases. We also heard in the morning in the panel that even rural areas, this kind of scenario is changing very rapidly. Now, we have already touched upon AI, right? That's one equalizer, the democratizer of all kinds of processes. So for example, when Mr. Jensen Huang was here in India 4 or 5 years ago, he gave a talk in Vigyan Bhavan, and he talked about how AI is rapidly democratizing all processes related to our common endeavor. Financial markets or the trade or whatever that we talk of, and health is not very far behind. And that's one way to go forward, that how AI very quickly, we adapt AI into our healthcare system is actually our immediate goal to do that, what we should be doing. Now, Dr. Arora very quite rightly pointed out that most of the data that exists on different kinds of disorders is actually borrowed from the West, at the moment from India. So we don't really know the basal parameters of whom we call healthy, whom actually we say that certain kind of disorder exists in that person. And that kind of data needs to be generated in India very, very rapidly. And wherever data that exists on today's date is on different formats in different places, so it cannot be integrated that very easily. And if we were to develop our own AI models or large language models or something based on this particular data, it should be our urgent necessity to actually get all this data accessible to our AI community, make it accessible, make it uniform, and make sure that this data can be used very meaningfully for the future of the healthcare.
All right, and clearly there is a need, and for this, we're a young country, we have such a, a burgeoning young population. Hopefully they can be encouraged to think on these lines of innovation. We all talk about startups. Dr. Gupta, anything you'd like to add to that, and where you feel, we need more innovations and how they could help in this Viksit Bharat 2047?
Absolutely. So, we were talking about AI, so I'll just talk two minutes about that. AI is the buzzword, right? Like Sir just said that, from trading to everything else, AI is being... So I think...
So we don't want people to go to AI for their consultancy as well. There's a lot of misinformation also.
Absolutely. So I think AI is what you feed in is what you get out.
Yes.
And that's how AI works. And that's what Sir said, that, what the data that is required to train those models is very important. But, with the various initiatives of our country of getting Abha ID and all the other the digital health missions, hopefully this will all be successful, and we'll have a lot of data that can be fed into for predictive analytics, right? Previously, if you think how the car would function, right? Previously, 20 years ago, you would have a car and you would take it for servicing when it would go bad. Then they started coming out with data. You know what? Every 1,000 kilometers, go get the tire pressure checked. Every X amount of kilometers, get the engine oil changed. So prediction started coming into the picture from data. So similarly, can we reach a stage where we can predict that this person has X, Y, and Z things? Can we predict that this guy is going to get this X illness? So can we do something to prevent that illness from happening before it has happened?
Preventive health, what we were talking about
Preventive
earlier.
health.
Yes.
And, AI, I don't think is going to, in healthcare per se, which is so sensitive, so important, I don't foresee it taking away jobs. I see it as your co-pilot. Like when you're driving a plane, there is an autopilot, there is a pilot, and then there is a co-pilot. I think AI is going to be your co-pilot. And I'll give you a small example. I'm a cardiologist, right? So I'm doing angiographies, angioplasties, and all those things. And that there is this technology we use called OCT, which is for improving your imaging during the procedure. And we would do that imaging first, and whatever data, the images that would come out, you would analyze it yourself, and you would make treatment recommendations. And that analysis would take a couple of minutes. So, this technology AI is going to be your co-pilot in your journey of treating patients.
All right, that's very interesting. So nothing to be, scared of. It's how we use it really and use it to benefit our people. Thank you so much. We're out of time. Thank you so much for joining us on this panel and talking about this, about a Viksit 2047, equitable health for all. Hopefully that dream can actually come true. Thank you.
A 36-hour non-stop flight by a small pack of B-2s. A lot of other aircraft were also involved, we know that. But let's talk about the B-2 flight itself. They took off from Missouri. 36 hours later, they landed back without once landing. They delivered their bombs 18 hours later over Iran and then came back. How was this possible? Because the Department of Defense says at no point of time on this 36-hour journey was there any reason to believe that they were either detected or reacted to?
Well, they weren't detected, because if they were, then they'd be in some serious trouble. It's one of the most unbelievable missions, one of the most historic long-range strike missions. There were 7 B-2s, which by B-2 standards is a fair number of them. There was deception in the very beginning. There was a sense that some of them were flying west across the Pacific. In fact, they weren't. And even if a few planes were positioned in one area, they were not going to be flying the Pacific route.
That was the big distraction.
On social media said, you see the bombers, they're now flying west, so you know what's coming your way. But no. They flew them east across the Atlantic. There were 125 aircraft in total involved. Refuelers were involved at every stage. There were fighter aircraft which linked up 4th generation and 5th generation planes, 5th generation being stealth aircraft. And then after an 18-hour flight one way, right, shortly before they struck their targets, which was primarily Fordo, using a remarkable weapon which we'll talk about called the GBU-57, 30,000-pound weapon.
Monster.
Before that took place, there were several land attack cruise missiles launched from American submarines and possibly destroyers as well. Possibly in the Persian Gulf, submarines, they don't tell us a location that could be as far out.
The American media says it was one submarine called the USS Georgia.
So again, location, I'm not sure if that would be Persian Gulf, could be the Mediterranean, could be the North Indian Ocean as well. But this is what I found interesting. By the time those land attack cruise missiles, Tomahawks, actually struck their targets in Natanz and Esfahan, the American B-2s had already left. So in other words, they launched their missiles first, but by the time the missiles hit, they were the last to hit their impact points. But that's just the nature of the weapons, which are a bit slower than, the aircraft going in the B-2s and dropping their bombs and then getting out.
A question that I'm often asked, Vishnu, is 125 aircraft were accompanying at various points of time. It's not like it was this big swarm of aircraft flying together, which people may be tempted to think when they hear the word 125 aircraft were involved. But tell me something. When the B-2s entered Iranian airspace or sensitive or contested airspace at any point of time, would the B-2s have been alone or would those 5th generation fighters have been with them?
The 5th generation fighters would have been with them, 4th generation fighters as well. And what we do know is that escort and support aircraft linked up with them and in a sense cleared the path of the B-2s, because what did they do? They deployed high-speed suppression fires against surface-to-air missiles. So they were being absolutely clear. Now, the Iranian radars wouldn't have likely picked up the B-2s at all. It's got a radar signature of smaller than a sparrow.
Tiny.
So you don't necessarily pick that up at all. But they weren't taking any chances. They were clearing the airspace for them, taking out through search and destroy missions, surface-to-air missile sites. The B-2s went in, dropped their bombs with precision, impact points in Fordo, and we've got those images up We've got fantastic satellite images, even new ones which have come in, showing the exact penetration points in Fordo. They then got out, and obviously they were accompanied by, I would suggest, F-22s and F-35s. This is the primary role, or one of the primary roles.
So those are the ones firing
F-22.
anti-radiation missiles, high-speed anti-radiation missiles.
No, I think those would be the. I think those would be F-16 and perhaps even.
Massive NDTV campaign impact. Raj Thakre's biggest climb down. MNS chief says slap only if someone acts smart. It's a mega reunion of Thakre brothers. Uddhav and Raj Thakre share stage after 20 years over Marathi pride. Raj Thakre says what Bala Saheb couldn't do, Fadnavis has achieved, while Uddhav Thakre says they have come together to stay together. Raj Thakre doubles down on his Marathi threat, says if you live in Maharashtra, you should know Marathi, tells his workers not to film their wives. A Mumbai businessman, Sushil Kedia, is forced to apologize after Raj Thakre's MNS workers vandalized his office after he said he will not learn Marathi. Chief Minister of Bihar, Nitish Kumar, has held an important review meeting for the law and order situation in the state after prominent Bihar-based businessman and BJP member Gopal Khemka was shot dead outside his home. Nehal Deepak Modi, younger brother of fugitive businessman Nirav Modi, has been arrested in the United States following an extradition request issued by Indian authorities. Congress leader Rahul Gandhi has set out on the India-US trade deal, saying Prime Minister Narendra Modi will meekly bow down to any deadline set by US President Donald Trump regarding reciprocal tariffs. Union Minister Piyush Goyal now has hit back, saying people have lost interest in Rahul Gandhi. Well, we start with a massive NDTV campaign impact. NDTV has been tracking the vandalism by MNS workers in the last few days in Mumbai and surrounding areas. Raj Thakre, MNS chief, today has advised his party workers that they should not beat up people unnecessarily, and that he has also asked them to use violence only as the last resort. He has also said that a slap is advisable, but he has softened his attack, saying that this is a prestige issue, Marathi pride is important, but one must not assault people unnecessarily. He has also calmed goons, and he has said that there is a need to create more awareness. He has also said that a slap is okay, but large-scale violence, unnecessarily beating up people, unnecessary assault on the people of Maharashtra is not something that they should be indulging in.
गुजराती माणसाला मारला, कुठच्या गुजराती माणसाला मारला? बाचाबाचीमध्ये समोरचा गुजराती निघाला, इकडचा मराठी निघाला, त्याच्यामध्ये काय गुजरात्यानं मारलं का? एवढे व्यापारी आहेत, अजून तर काहीच केलेलं नाही. अर्थात त्यांना मराठी आली पाहिजे याच्याबद्दल वाद नाही. विनाकारण उठसूट काय मारामारी करायची गरज नाही आणि मारायची गरज नाही. पण जर जास्ती नाटकं केली तर कानाखाली आवाज काढलाच पाहिजे तुम्ही. पण चूक त्यांची असली पाहिजे. आणि एका गोष्टीचं लक्षात ठेवा, अशी कधी गोष्ट कराल त्याची व्हिडिओ काढू नका. आपल्यामध्येच त्यांना कळलं पाहिजे. कळलं का? मारणारा कधी सांगत नसतो, मार खाणारा सांगत असतो मला मारला म्हणून. त्यांना सांगू देत. पण याचा अर्थ उठसूट कोणालाही उगाच मारायचं काही कारण नाहीये.
Okay, my colleague Radhika joins us with more details on this. Radhika, Raj Thackeray asking his workers not to film their violence, not to brag about it, but send out the message by doing what they need to do, by giving a slap here and there, but not really indulging in large-scale violence. What is the message that he's trying to give out here?
That's right. Raj Thackeray has not vociferously apologized for what his workers did, but he has certainly softened his stand. He has said that if the other person goes overboard by insulting Marathi, then perhaps go ahead and slap, but do not take law and order into their hands, is the messaging that's been given by Raj Thackeray. So certainly a change in stand, especially post what has happened and the outrage that we saw over the last few days as a result of that man getting beaten up, the shopkeeper getting beaten up by the MNS workers, and the police action post that. We know that Devendra Fadnavis has also promised further action. So amid this, Raj Thackeray in that particular speech